Hello everyone, this is Dr. Aarthi, Pediatric Oncologist at Shankara Cancer Hospital and Research Center. Today I'm here to break few myths about pediatric cancer. So for many of us, it's even hard to believe that children can get cancer. Cancer is usually associated with older age and toxic habits or lifestyle. And when we say children can get cancer, it's sort of a surprise for many of us. So which is the reason for this video. Here are some common myths, some common misconceptions which people have, which is what we are going to address in this video. So the first thing starts with pediatric cancer is a death sentence. So this is a common misconception. Pediatric cancer is in fact one of the success stories in history of cancer treatment, because many cancers that happen in children like Wilms tumor, sometimes the standard risk ALL or the acute lymphoblastic leukemia, they all have success rates up to reaching 95%. So that means that many of the cancers that happen in children are treatable and can have a cure rate with good quality of life as well. So pediatric cancer is not equivalent to death sentence at all. There are certain tumors which are associated with poor prognosis, commonly the high-risk neuroblastoma or the metastatic osteosarcoma, but they are definitely much rarer compared to the other tumors which happen in children. The next thing is the child loses every reason to live. So this is also a common misconception. So usually children who come to us are quite sick because of the disease burden. So in the initial phases, until the chemotherapy starts having an effect, they may be sick, but overall once the disease has come into control and they go into remission, they are as playful and as well as other children, except for that they lose their hair and they have some skin and nail changes. Otherwise it would be very difficult to make out that this child has cancer and is undergoing chemotherapy. Most of the children tolerate chemotherapy very well. So taking chemotherapy is a painful procedure. So this is something that is thought of even in case of adults, where undergoing chemotherapy sessions is considered to be a painful procedure. But in pediatrics, we mostly use chemoport, which is a device which is inserted within the skin of the child in the subcutaneous plane, which is what we call. So it is under the skin, through which we will be able to access the veins and directly administer chemotherapy. By using these chemoports, we will avoid any sort of pricking, and even for sampling on day-to-day basis or frequent sampling, we need not prick the child. We just have to draw blood from this device directly. So chemotherapy is not at all a painful procedure, and it is very well tolerated, especially in the pediatric age group. So it is commonly felt that children with cancer cannot mingle with their siblings or with other members in the family because they may also get cancer from them. So this is a misconception, because cancer is not contagious. By contagious, what we mean is it can spread easily from one person to another. So only infections are known to be contagious, whereas cancer is not contagious at all. The only reason we ask them to isolate themselves from crowd and crowded places in general is because of the risk of infection that they carry. When we administer chemotherapy for them, they generally tend to have low counts, because of which they are prone for developing many infections. So to avoid this is the only reason why we ask them to avoid crowded places. It is not because somebody else can acquire cancer from them. Cancer is definitely not contagious. So cancer in children and cancer in adults is not the same. The primary difference is the type of cancers that children get are very much different in comparison to type of cancer which we see in adults. So children have a different set of tumors which are entirely different from the spectrum that is seen in adults. Apart from this, with respect to tolerance to chemotherapy, children tolerate chemotherapy very well with very minimal side effects, primarily because they don't have any existing comorbidities. By comorbidities, what I mean is organ dysfunction because of age, primarily hypertension, diabetes. So all these things are very uncommon in children. So because of these reasons, children tend to tolerate chemotherapy very well. And the other major difference when it comes to pediatric and adult cancer is that in an adult, when we see someone with cancer, we are probably going to add 10 to 15 years to their life. Whereas in children, it's the whole life ahead of them which we have to take into concern and always weigh between the risk and benefit and decide on the chemotherapy or radiotherapy or subsequently need for surgery. So in pediatrics, usually it is a multimodal management which includes surgery also, radiotherapy also, as well as chemotherapy, and all decisions are taken weighing the risk as well as the benefit. So by treating the child, we also want to add meaningful years to the child's life so that the morbidities are as minimum as possible. So hair loss is not a permanent phenomenon. Hair loss commonly happens because of the chemotherapy that is being administered. So chemotherapy, just like how it acts on the cancer cells which are dividing, it also acts on the normal cells which are dividing, which includes hair, nails, skin, all cells in fact. So because of which we expect certain side effects. The same way hair loss also is a common side effect associated with chemotherapy, but it is not a permanent change. It's a temporary phenomenon, and once we stop chemotherapy, once the disease goes into remission and we stop chemotherapy, within a few weeks to months the hair growth will begin again. Once treatment is complete, child is cured of cancer. So this is partially true, but it is not complete, because the more information we have, well informed we can as well be. So certain cancers have varying duration of treatment. Suppose a solid tumor, a Wilms tumor which is from the kidney, may have treatment as short as even 12 weeks or may go on up to 6 to 8 months, whereas leukemia, which is the most common pediatric malignancy, will be treated for 2 to 2.5 years. So this can again vary based on the risk category into which the child would fit in. So the duration of treatment does not indicate whether it is cure or not. It would only indicate that the child's disease is currently inactive and the child is in remission. But to qualify someone to be cured of the disease, it would usually be up to 2 years after follow-up, after completion of chemotherapy, when we call them survivors of cancer and that they are completely cured of the malignancy. Now, why we need to know this is that once we have the good information, we can make adequate lifestyle changes and subsequent follow-up for certain side effects of chemotherapy which can happen in long run when we give chemotherapy to such young patients. So these things have to be followed up, and there would be a video separately indicating the same thing. So the more well informed we are, the more care we can take care in the further life, so that we can avoid or we can diagnose problems early and treat them adequately. So do not tell your children about the diagnosis that they have cancer, as it would scare them. So this is something which we routinely hear from our parents. They talk to us about this in length in the counseling sessions. But I would personally recommend the parents to reveal the diagnosis to their children. What would scare them more is that the parents are worried, doctors are giving some medications, we're regularly going to the hospital, but they are unaware of what exactly is happening to them. So when this happens, they assume that something is really wrong and they wouldn't even want to share it with the child. So that would scare them more than the diagnosis actually. So especially for children who are 8 plus or 10 plus more so, who definitely have access to internet and can easily find out what cancer means or already know what a cancer means, it is very important that parents reveal the diagnosis, or if they are comfortable, that the doctors or the treating people reveal the diagnosis, so that the child feels comfortable in the environment. That would help them accept the chemotherapy and that they would be cured of the cancer, and they would get hope from the people around them, instead of hiding the fact, which would add to the tension, and they would have a lot of questions which are unanswered, which will just make them more scared and more defiant, and probably would not end up cooperating properly for the chemotherapy. So children who are treated for cancer when they grow up to adults will be sterile or will be infertile, is what a common misconception is. So again, this depends on what type of chemotherapy and what type of radiation the child has received. So only certain agents are toxic which can affect the function of testis and ovary. But however, now with advanced technology, there are specialists who will be able to surgically operate and transposition the ovary or the testis to a different site in case radiation is essential for organs in the pelvis, which is the site where the genital organs are as well located. So depending on the type of chemo and radiotherapy, only then we will be able to say whether a child when they grow up would be infertile or not. It is not a disclaimer, or it is not a common sentence for all children who are treated with cancer. So what is chemotherapy? What exactly it involves? So chemotherapy is just a medication which is given through an IV axis. By IV we mean intravenous. So it is given through the cannulas which are inserted peripherally, or it can be given through various devices which are specifically meant for administering these agents. It does not involve any surgery. It is not a painful procedure. So commonly it is administered through an IV cannula or through devices such as chemoport or central lines, which are more commonly used in pediatric age group. So these were certain points which we got as queries when we sat and spoke with many parents in length. So if you have any queries, you can please let us know and we will be more than happy to clarify those doubts as well. So pediatric cancer definitely has very high cure rates. As we don't know the reason why pediatric cancers happen, prevention is still a far-fetched dream. However, early diagnosis and appropriate management can help us cure many children with cancer, and the hope is what we have to believe in. And September is Pediatric Cancer Awareness Month, and in this month we have taken this initiative to ensure that these videos reach each and every person and will help us to diagnose early in pediatric cancers. Thank you.